Hey everyone, Alex from O'Brien here. We get a lot of questions about optimal tooth reduction, and today I'm going to give our prep recommendations for the most common restoration types. It's important to note that our recommendations are based not only on ideal aesthetics, but also for longevity of the restoration. Full cast restorations require the least amount of preparation with as little as 1/2 millimeter axial reduction and 1 millimeter occlusal reduction. If you end up with less reduction on the occlusal surface, it won't affect the overall strength, but it will reduce the lifespan of the restoration as the patient will wear through the gold much faster. Full cast margins can be prepped with any margin style, including feather edge, which makes them a very forgiving restoration for difficult preps. Similar to full cast crowns, zirconia restorations also require less reduction than other materials. Unlike full cast gold, however, the strength will be affected if it gets too thin. For this reason, it's recommended that you allow for the material thickness to be a minimum of 0.6 of a millimeter for full zirconia crowns. The style of the prep is also less forgiving than with full cast. Mainly, you want to make sure there aren't any sharp edges or corners, as those create stress concentration points that can lead to cracks in the material. This is also true for any crown that is made of a ceramic material, including PFMs, e.max, and porcelain veneers. So, when prepping for zirconia, we recommend a 0.7 millimeter chamfer margin with axial reduction of 0.8 to 1 millimeter and occlusal reduction of 1 to 1.2 millimeters. The prep requirements for porcelain to gold crowns vary significantly depending on the frame design. A standard PFM with porcelain occlusion requires 0.7 chamfer margin, 1.5 millimeters of occlusal reduction, and between 1.5 to 2 millimeters of buccal or facial reduction for optimal aesthetics. The addition of a porcelain labial margin will require it to be prepped with a 1 millimeter butt joint. Full contour e.max crowns should have a 1 millimeter chamfer margin with 1.5 millimeters axial reduction and between 1.5 and 2 millimeter occlusal reduction. When there's adequate occlusal reduction, e.max crowns can be conventionally cemented. However, we still recommend bonding whenever possible, as clinical studies have shown that bonding nearly doubles the static load-bearing capacity of the material. If the occlusal reduction is less than 1.5 millimeter, then bonding will be necessary in order to maintain structural integrity of the restoration. If you have provided the minimum 1.5 millimeter reduction and then find that you need to adjust the occlusion of the crown during seating, this would cause the material to go below the 1.5 millimeter threshold, which would then also require bonding. For e.max veneers, we recommend a reduction of 0.6 millimeters in the cervical and labial areas and an incisal reduction of 0.7 millimeters. For a quick reminder of this information, you can always refer to our prep guide, which is available at the link below. I hope you found this video helpful, and as always, feel free to contact us with any questions. See you next time.